This video shows the steps you will follow using the AllerFocus 80 allergy skin test. First, make sure the patient fills out the questionnaire and signs and dates the consent form. Keep this documentation in the patient's medical record. This test requires these materials: dip wells with applicators, carry tray, test report form, measuring tool, alcohol, cotton balls, and 4 packets of sterile applicators. Tell the patient this allergy skin test uses plastic applicators and they will feel a prick when the applicator is pressed onto the back. You can assure the patient there are no needles and no blood is drawn. You will test for 78 allergens. Ask the patient when they last took allergy or asthma medications. Refer to the page that shows which medications to avoid. Explain the test is conducted on the back and they need to disrobe from the waist up. Provide a gown that opens in the back for females. The patient lies on their stomach for the duration of the test. Follow these steps. Remove the dip wells and carry tray from the refrigerator and place them beside the examining table. Apply a liberal amount of isopropyl alcohol to a cotton ball and clean an area of the back large enough to accommodate the number of applicators you will use for the test. The skin testing aid form includes instructions on how to place the applicators. Remember, everyone's anatomy is different. You are looking for the best area or plane for the test. Place the applicator on the patient's back with the arrow pointing toward their head. Leave at least 1.5 inches between each application. Hold the applicator perpendicular to the skin and use moderate pressure to press down about 2 to 3 millimeters. Use caution and apply less pressure on older patients who have thin skin that can bruise easily. Keep the applicator on the skin as you rock it from side to side approximately 20 degrees in each direction, back and forth about 6 to 7 times. Lift up the skin testing device. You should see visible marks on the skin but no blood. Discard the skin tester. Repeat these steps until you have used all testing applicators. Leave the room for 15 minutes and when you return, measure the flares and wheals on the patient's back. Record the measurements on the test report form. You can see how to do that with the instructions on the testing aid form. Wipe the patient's back with alcohol again. It will help you during the measuring process. Use the skin reaction ruler to measure the positive control A1 histamine to make sure the patient can develop an immune response. Next, measure the negative control A6 glycerin. It will be used as a baseline reference point. Continue measuring with A2. Measure every allergen and record the result in every box. Write down a 0 for spots that have no reaction. A positive result occurs when a result measures 3 millimeters more than the negative control. Apply anti-itch cream to all reactions. The test is now complete. The practitioner will review results with the patient, discuss treatment options, and schedule a follow-up appointment if it is needed.